effectively, much like every other provider in Australia, this is an unprecedented period of change in aged care. It's the biggest change nationally since Medicare was introduced 20 odd years ago. So the changes that are facing us are widespread, substantial and challenging. And as an organisation, we need to stay across those changes, but we also need to find ways in which we continue to evolve and be agile with those changes. So certainly some of the things that we're looking at is improving our physical environment and our service environment for our clients. We're also looking at making changes to our model of care, moving away from the traditional style, but actually move more to a home-like style in our services and supporting that with physical environment. But also moving towards understanding where new innovations and assistive technologies can be applied. We know in the aged care roadmap that one of the main focus areas in government policy is actually to keep people at home or help them stay at home as long as possible. So where can we use not only services but also assistive technologies to help either delay or postpone that entry into residential aged care and allow independence and wellbeing in the community as long as possible. So they're probably the three main areas of focus for us. Well, the new survey is quite innovative. We're probably one of the first in Australia that I know of who uses a grouped question methodology for our survey. If I asked a very simple question of, is your coffee that you order the same as my coffee that I order? In most cases the answer is no, because we go in expecting a different service or a different experience. And in reality what our survey looks at is how do we measure the experience first before we measure the satisfaction, because then what we can identify is where the gap exists, because in reality our focus should be on closing the gap between expectation and satisfaction. And so our survey looks at that and looks at a very novel way of representing that so we can show the changes and improvements over time. Well, the key driver for us was moving past a traditional model which measured, say, satisfaction out of 10. And so if a person said 7, what does 7 mean? How can we take 7 and put it into a continuous improvement plan? How can we take 7 and tell the community that we're performing well? So what we looked at was how do we take that information and make it meaningful? So the survey method allows us to do that. It helps identify around certain domains and certain questions where improvements can be made locally and at an enterprise level. So the ability to take specific questions, the responses to those, provide those to the program area and assist them to develop up improvements in line with those is where the key benefits are from the survey tool. I think the major thing for us is it actually did something we didn't expect. It actually helped us understand where client expectations were. It actually showed us, and it busted some myths. The idea that we had a view that clients or residents would see the built environment as having the highest amount of expectation around it, when in reality that was below social activities and below cultural observance for our community. And so what it helped us understand is where the really important areas were for our clients. So even before we look at the level of satisfaction, it gave us insight we'd never had before. What it also allowed us to do was identify areas where expectation was either extremely high, almost unrealistic, or extremely low. And they're concerning too, because they're marketing questions. Have we set expectations that are too high and not been able to meet them? Or have we not communicated the value of our services and the quality of our services well enough? And that's where some major changes have been made. That's informed website design, print media, customer value propositions and so forth. So that's probably been one of the positive things we didn't expect, but has been a major change in the way we deliver services. We're committed to the survey methodology, and certainly the survey itself will change over time. We're looking to move it, and we already do it in English and Russian, which is relevant to our community. But what we're looking to do now is actually create an easy read and an easy English version to make it more accessible. We're also, and that's in the survey space, and we'll be doing that in the next 6 to 8 months across our programs. But also for our organisation, we're implementing a new model of care and residential care called Hand in Hand, and that's moving to more a home-like environment, and that environment will then inform the future design of our new services, our built services. We're increasing our footprint in community services, and we're increasing our footprint in healthy ageing. and looking at ways in which we can grow and develop those services in a more meaningful way as well. And the new bastion for us is assistive technology, and looking at the way in which we can implement assistive technology in a viable way. So there's lots of challenges. We're implementing NDIS soon as well, so for us there's change on every bastion. But it's an exciting period, and there's a very simple clause, change is inevitable but misery is optional. You've got to stay in front of it, you've got to stay part of it, you've got to stay motivated and involved in order to ride that change wave. Oh look, I can think of three things for myself. The first is the networking, the ability to bump with people from various different industries within the health sector. But also the next part from that is hearing what they've done, hearing where they're actually making some improvements and changes and innovations that we could learn from. But the third part equally is for us being able to share our innovations, be a knowledge leader and a thought broker in the industry as well. They're probably the three areas that I would say are a major benefit of these sort of events.